Mild gastrointestinal upset is probably the most frequent side effect of antibiotic therapy. And rarely, severe allergic reactions may actually lead to acute anaphylactic shock or serum sickness syndromes. So if we actually summarize, the effects or adverse effects of antibiotics may be predominantly seen in our gastrointestinal tract, on our skin, on our hemopoietic system, our renal system, and our liver. In our gastrointestinal tract, the antibiotic activity can upset the balance of the normal flora. Now, beta-lactams are especially likely to do this, which this actually results in the overgrowth of common cell organisms such as Candida. Now, alternatively, antibiotic therapy may provoke diarrhea or more seriously, pseudomembranous colitis. If we talk about our skin, the cutaneous manifestations range from mild urticaria or maculopapular, erythematous eruptions to erythema multiforme, and a life-threatening syndrome, which is known as Stevens-Johnson syndrome. But most cutaneous reactions are actually mild, and they may resolve after discontinuation of therapy. If we talk about the effects on our hematopoietic system, the patients receiving chloramphenicol or antifolate antibiotics may exhibit dose-dependent bone marrow suppression. And more seriously, aplastic anemia may rarely complicate chloramphenicol therapy. High doses of beta-lactam antibiotics may actually induce granulocytopenia. And now antibiotics are a rare cause of hemolytic anemia. And many antibiotics cause a mild reversible thrombocytopenia or bone marrow depression. Now, to explore more about thrombocytopenia, you can actually refer to our small clip, 3 Causes of Thrombocytopenia, here on sqadia.com. If we specifically talk about our renal system, over here, the aminoglycosides may cause renal toxicity by damaging the cells of the proximal convoluted tubule. And patients who are elderly and have pre-existing renal diseases or are receiving other drugs which cause renal toxicity are at a higher risk. Another antibiotic, tetracyclines, may also be toxic to the kidneys. In the liver, isoniazid and rifampicin may cause hepatitis. Now, this is more common in patients with pre-existing liver diseases. Now, other agents that are associated with hepatitis are tetracyclines, erythromycins, pyrazinamide, ethionamide, and very rarely, ampicillin or fluoroquinolones. Cholestatic jaundice may also follow tetracycline or high-dose fusidic acid therapies. So this brings us to the end of this video. We talked about the principles of antibiotic therapy, which factors govern the choice of antibiotics, the different routes of administrations, and why monitoring is important in the case of antibiotic therapy, and the adverse effects of antibiotic administration. I hope you learned something new today. Stay tuned on sqadia.com.